Now, in case you have been wondering on how you can go about our healthcare systems in Nigeria, and you've been one of those persons complaining and thinking of the way forward, then this is the time for you to stay tuned and listen to what we would be discussing today. On the show, we have Kemi Olawoye. Good morning, and you're welcome.
Good morning. Thank you so much
for having us this morning.
Thank you for having me.
Thanks for joining.
All right, so we're talking about building blocks to accessible healthcare in Nigeria. And now, first off, I would like to understand what the situation and place of our healthcare system is in Nigeria.
It's certainly not accessible. Healthcare is certainly not accessible to an average man. And that, due to a lot of reasons. And I have to say that at this time that this topic could have been more timely. There's a lot going on right now in the healthcare system. I'm sure that you probably follow social media. We have people complaining, some complaining that they've probably gone to the hospital. They're not able to access care. We have a lot of people dying from things that are treatable. We also have more recently, the Nigerian Medical Association announced the exodus of doctors outside the country. So there's so much going on right now in the healthcare system, and it's such an appropriate time to talk about something like this. As regards to accessible healthcare, there are several building blocks, but the first one I'd like to talk about is affordability of healthcare.
Yes.
We understand that in the country where we are, we have over 50% of the Nigerian population living, below average. So it means that for them to really be able to access care, it really needs to be very affordable. And what I always say is that in Nigeria, if you feel like you have money, say you're earning 150,000.
Okay.
On an average, a Nigerian is earning maybe 150. A comfortable Nigerian is earning 150,000 to 100,000 naira a month. I mean, I always say that God forbid that something happens and you need to access healthcare, then you would realize that that is no money. Because in 5 days of being in the hospital, you can exhaust 5 million naira. And so it really just shows how the healthcare is not affordable. And the different measures that could be taken to that. But the first one I'd like to touch on is more focused on the government, and it's really more about primary healthcare centers. I find that in Nigeria, we don't really understand the purpose of primary healthcare centers. You just have like a slight headache. The next thing you are heading to general hospital. You're going to a tertiary institution. But the first place should be primary healthcare center. When you go to a primary healthcare center, and then they now realize that, oh, this is beyond us, they now refer to like a tertiary, or secondary healthcare institution. So the first thing we need to get right is our primary healthcare centers. Unfortunately, I also feel like why people have that notion and why we've been able to build that notion over time where people don't even feel like they're primary healthcare centers is because we don't even have really nice primary healthcare centers. You'll find that when you go to a lot of them, when you're speaking, it's probably even echoing. That shows like there's almost no one there. There is no material there. Just probably have like one nurse there. There's probably no doctor there. So it's really not well equipped. It's not well equipped. It's not well taken care of. So the first thing is really for the government to put systems together to be able to put our primary healthcare centers in place. And then, we can. So I have a lot of things to share, but I'm sure that.
Now, speaking of primary health centers and the likes, I even want to paint a much more gory picture. A lot of people would rather just walk into a pharmacy.
Pharmacy, yes.
Yeah.
A pharmacist and say, please, headache, paracetamol 50, so 100.
And prescribe, that's
self-diagnosed,
self-medication.
And then they just buy. Over-the-counter drugs are how much? And then they go. But then the question is, if we really want to talk about building blocks of Nigeria's healthcare system and talking about reforms, talking about accessibility and affordability and all of that, should it not be that we all, as a country, as individuals, need to come to terms with what good health or what healthcare provision, should be?
Yeah, the second building block I'll be speaking on is information, and that's where we talk about the roles of different healthcare providers, but still under affordability. Beyond the government putting together primary healthcare centers, another major one is insurance, and it's something that we really don't take very seriously in this part of the country. I understand that there has been a lot of issues where people would say, oh, I have health insurance, but when I tried to access healthcare, I couldn't use it, or they said that, oh, my healthcare. Yes, that one is the corruption issue that we have in Nigeria. But the truth is that health insurance is extremely important. The same way car insurance is very important. We know that even you just park your car and someone would come and hit you. Just a few days ago, I parked my car and someone came and hit my bumper somewhere. That's how it is. The same way human beings are. You can be feeling well now, and tomorrow you're having you're not feeling well. So health insurance is so, so important. And the way health insurance works is such that they risk pool, just the same way all forms of insurance. You donate some form of money every month, and then, or every year, depending on whatever package it is that you're on. And then when it's time for someone to access healthcare, they take out of that money. And then if you don't need healthcare throughout the period that you paid for that, you won't be able to, your money is sort of gone. But it makes a lot of sense. Another issue we also have with health insurance is that we've made health insurance like a white collar kind of thing, where you find that it's only people that are working in a 9-to-5 job, people that go to offices that have health insurance. Thankfully, because employers are beginning to, come to terms with the fact that their employees need to have health insurance. But we also need to understand that, and unfortunately, I still need to talk about the government in this instance. We need to build health insurance systems that works for the kind of country that we have. In a country where we have less than 50%, more than 50% of the population living below poverty level, it means that we need to build the insurance that suits them. So a typical example might be to have like insurance for market women. A situation where maybe they are donating 500 naira or they're donating some form of money every year, something they can afford. So we really need to build insurance for the people, for different cadres, for everyone. Bus drivers, can we have like the body for bus drivers have like something where they're able to put money? A lot of them take drugs, they take alcohol, they take things that affect their health. So we need to build health insurance, but health insurance is absolutely, for us to be able to access healthcare, health insurance is extremely important. Everyone should have health insurance at this point.
All right, before we continue with the conversation, I would like to open the phone line for you to call in and ask your questions or give your contributions on today's discussion on building blocks for healthcare system in Nigeria, for accessible healthcare systems in Nigeria. So call us on +234 7051 432258. The numbers are displayed on your screen. So call us, let's know your question or your contribution on today's topic. Still speaking with Kemi Olawoye. Now, you mentioned two factors of affordability and the assessment of our healthcare systems. What then, because it's one thing for us to, lay out these challenges and lay out these issues. What then do we need to do moving forward when it has to do with the healthcare system in Nigeria? You have rightly mentioned our primary health cares. Now, even healthcare providers, because I hear people talk about the challenges of having to go to the hospital and they're treated badly by healthcare providers.
The way they're even spoken to.
The way they are spoken to. So that doesn't even encourage people to want to go and, check for their health or try to, save some money to go to the hospital. So now there are two factors that I have stated. That's affordability, being able to afford the treatment you'll be given, and also the healthcare providers, their way of behaving towards the patient. What do you think we can put in place moving forward?
Okay, so in terms of affordability, I haven't highlighted the major challenges with the probable solutions, rather. Means that putting our primary healthcare systems, primary healthcare centers together. I know that as of last year, I know Lagos State and Ogun State started to do public-private partnership, such that they outsourced some primary healthcare centers to private providers. I'm not sure how that will work, because if I were to be a private person and you give me, I'm thinking of making money. And a primary healthcare center should be extremely affordable. Don't forget that even like those that sell things on the road, their first point of call is to go to primary healthcare centers, especially when they're pregnant and everything. So I don't know how that is currently working. I don't know if that is working in the way it should work, but the primary healthcare centers need to be fixed for affordable healthcare, health insurance, and also really public-private partnership. And that still falls under the category of also investments, external investments. We all know that in Nigeria, unfortunately, our system and our policies don't attract investors as much as it should. It's not favorable for private investment, but we really need private investment. I always say that healthcare is very expensive. Healthcare is really, and it's not even healthcare is expensive, and it's not a Nigerian thing. It's all over the world. Even in a country like America, they've not gotten the healthcare system right. I think that more of London and Canada might have, but America hasn't still got it, because healthcare is really expensive. Why it might not be such an issue for them is because an average person still lives above $1 and everything. So but healthcare is actually expensive. If I tell you how much it takes to just buy one hospital bed, millions of naira. Just the hospital bed, not to talk of drugs, not to talk of facility, paying for rent and all of that. So healthcare is really expensive. So for us to even establish maybe more general hospitals, we actually need private investment. The government cannot do it all. The different sectors of the economy that the government needs to put in place. So we need external investment to be able to put all of those things in place. Another thing, again, still on the affordability, is The WHO has clearly stated that 15% of your budget should be allocated to healthcare. Unfortunately, in Nigeria, we're struggling with 4%. So how are we going to be able to produce healthy citizens when 4% of our budget is allocated to healthcare
system?
Health system. We don't really take
And then
ourselves...
even the 4%, how evenly distributed is it?
Is it, so those are like very, very major issues. And then now to your question, you mentioned the attitude of healthcare workers. It's really due to a lot of things. The first thing is the fact that I mentioned earlier on the show that recently Nigerian Medical Association just announced again that the rate at which doctors are moving out of the country is alarming.
Yes, that's
It's alarming.
Yes.
And beyond even doctors, even pharmacists, all the healthcare providers. I finished as a physiotherapist, and everyone, I know a lot of my colleagues that, I know at least almost half of my colleagues that we finished together are already in different countries across the world. A lot of people are moving out of the country. So what now happens is that the few that are left in the country, there's so much work to be done. The WHO has also stated that the ratio of doctor to patients, in Nigeria, we have a ratio of doctor to patient about 1 to 1,000. Don't forget that a doctor is human.
Yes.
As well, yes.
He's human. He's already at this shift since 8 a.m. He's there, patients are coming in. If he needs to just step out for a minute to eat, you don't want to see me, doctor, now what for you? I've been waiting. So how can they really, in a system that works, function? Someone hasn't eaten from 8, it will probably even diagnose you wrongly. It's a simple issue. That's one. Two is that I also really strongly believe, and this is something I share with my colleagues in the healthcare sector, I really strongly believe that the educational system, the medical, doesn't allow you to understand that at the end of the day, patients, they always say customer is king, patient is king.
Yes.
Unfortunately, the way the educational system happens in Nigeria, in medical school, because I finished from College of Medicine, University of Lagos, and I know that that thing needs to be imbibed in you. You need to understand that your patient is king.
Hello there. Did you just enjoy that beautiful video? Don't worry, we have more for you. All you have to do is click on the subscribe button and ring that little bell for more notifications. Tea or coffee will be served for you.
When you go to a primary healthcare center and then they now realize that, this is beyond us, they now refer to like a tertiary, or secondary healthcare institution. So the first thing we need to get right is our primary healthcare centers.